everyone, I'm Marjan. I'm from Belgium but currently studying at Karolinska Institutet in Sweden. My research is about maternal and child healthcare utilization and was a qualitative study in Cox's Bazar in Bangladesh. So first, where does Bangladesh stand? Here we have a graph from Gapminder with on the one axis maternal mortality, on the other one infant mortality. Bangladesh already did come a long way since the 1980s, don't be misled by the axis, but they still have a way to go to catch up with the other countries. This is also reflected in MDG 4 and 5. MDG 4, here was a goal to have maternal mortality at 143 per 100,000 live births. In reality, they are at 194 to 218. For skilled attendance, the goal was 50%, and in reality, they are at 31.7%. For MDG 5, the goal for under 5 mortality was 48 per 1,000 live births, and in reality, they are at 44 to 53, depending on the source. These topics are also reflected in the Sustainable Development Goals. Then, the research question. Which forms of health behavior do women display in relation to maternal care? And which factors influence our maternal healthcare utilization? Secondly, which forms of health behavior do mothers display regarding their children? And which factors influence the healthcare utilization for children? Now, it was a qualitative research in Cox's Bazar. This is where Cox's Bazar is, the whole of Bangladesh, and here we have Cox's Bazar. It was a purposive sample, and of course this study also has some limitations. First, an interpreter was used. Secondly, the interviews took place at the offices of an NGO hospital. It was highlighted to the women that this would not influence their future healthcare, but still it might have affected their responses. So, I used Anderson's behavioral model, who says that predisposing factors, enabling resources, need factors influence health behavior. Now, there were 4 options for health behavior for the mothers. Deliver at the hospital, deliver at home with a traditional birth attendant, deliver at home with a skilled birth attendant, and deliver at home without an attendant. Now, the predisposing factors for maternal healthcare utilization are religion. This was that the women ascribed it to their religion that they couldn't go to the hospital with male doctors. Maternal education and health beliefs. An example of health beliefs is this quote. I was worried. If I had gone to the hospital, they would have asked me to have a C-section. There were a number of women who believed that if you go to the hospital, you will always have a C-section, disregarding the need for it. The enabling resources are transport, autonomy, and cost. Weather is associated with transport because sometimes, because of the rains, it can be difficult to reach a hospital. Autonomy and cost are reflected in this quote. She says, I wanted to go to the hospital, but my family-in-law did not allow. There was no money to deliver. I was obliged to deliver at home. Then, the need factors. The importance given to delivering with a skilled birth attendant, the fear for complications, and the perception of their own condition. Here she says, my condition was bad, I was swollen up, it was risky for my life, I was very weak. Then, the health behaviors for children. Baby taken to the doctor, baby taken to the pharmacy. It's important to note that the pharmacies in Bangladesh are unlicensed and untrained. Self-medication by the mother and traditional medicines given to the baby. Then the predisposing factors influencing healthcare utilization for children. Here we have cultural beliefs. She says, my boy was unbelievable, he was so beautiful, God had to take him away. This is a way of coping with the loss, but this could also have influenced her access to healthcare. Then, enabling resources. Here we have decision making, if the mom could make the decision herself or if she had to wait for her husband, and the cost. This woman says, I treated my baby with injections because I didn't have money and my husband was not yet home. I treated her, I sat on a syringe. It said how much I had to give. I called my sister who could read and write, and according to a paper, I treated my baby. Then, the need factors for the healthcare utilization for children is the severity of the disease. This is reflected in this code. If the baby had not too much fever, I observe him for a day or 2. I go to the doctor if it says I'm become serious. So, this was in very short my research in Bangladesh. I hope it was interesting to you and thank you for listening.